The Ministry of Health is preparing to take several new approaches for the successful rollout of the Human Papillomavirus HPV vaccination campaign slated to commence later this year. Dr. Martin Campbell, coordinator of the VIA program at the Ministry of Health, told Nightly News exclusively that the campaign has been placed on a temporary hold since resources have been shifted to respond to the spiraling coronavirus cases Guyana continues to witness. In the last two HPV vaccination exercises a few years ago, consent was sought from parents before vaccinating children through parent and teachers associations. However, in the forthcoming campaign, there will be an opt-out system in place for parents or guardians who do not wish for their children to receive the jab.
So instead of us requesting from the families permission to give the vaccine, the families would in turn have to take the responsibility to request that we do not give the vaccine without, so it's just opting out of the vaccine. So
the HPV vaccination drive has been launched twice, in 2017, then 2019. The uptake for the jabs, which were exclusively given to girls between the ages of 9 to 16 years old, was significantly low. Approximately 30% of girls in the target population had taken the first doses of the vaccine, while second doses uptake stood at 15%. Dr. Campbell pointed out that one of the major contributing factors for the low vaccination coverage is the myths that were circulating.
Parents, because we would have targeted mostly females, parents would have, some persons would have talked about the vaccine affecting their reproductive organs, affecting their sexuality, a lot of things that are based on untruths or miscommunications.
He further divulged that the ministry plans to undertake educational campaigns to dispel those myths and ensure the right information is accessible to parents. Dr. Campbell added that there have been no significant side effects documented in Guyana and abroad since the vaccine was developed 30 years ago. This time around, HPV vaccines will also be accessible to boys within the 9 to 14 age range. The VIA coordinator explained that sexually active men and boys can carry the HPV on their genitals if they had intercourse with someone who has the virus. As such, the vaccines will offer protection to boys before they begin exploring sexual activities. Cervical cancer occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is caused by strains of the human papilloma HPV virus, a sexually transmitted infection. Each year, 60 to 70 women die from cervical cancer locally. An estimated 120 women are diagnosed with the disease annually. During the month of January, which has been designated Cervical Cancer Awareness Month, the Ministry of Health has planned several outreaches across the country to provide free access to cervical cancer screening. Temika Rodney reporting for the HGB Nightly News.